Hi, this is Will from Chiropractic. Today we're going to take you through some spinal mobility exercises that you can do in your own home. So you can use a yoga mat if you like, however the carpet's pretty soft. So we're going to start off in the quadruped position. We're going to start with the middle back. The hands are going to be beneath the shoulders, the feet beneath the hips. So we're going to start with taking the spine into flexion. We're just going to raise the middle back, dropping the head into flexion. Stay in this position. If you can take it further, take it further. Then we're going to drop into extension. A few common pitfalls are people overarch the lower back, but we're concentrating on the middle back, so I want you to drop your sternum towards the floor. Hold it for a second, go a bit further. So I'm not overarching my lower back, I'm trying to drop my sternum to the floor, straightening the middle back. Go back into flexion, drop the head a bit into flexion, and stretch the middle back. Pause a second, go a bit further, and back into extension. So head into neutral, slightly extended neck, don't tilt it back. Again, drop the middle back, drop the sternum towards the floor, into this position. Go a bit further if you can. So the shoulders are coming back. I'm trying to straighten the middle back. That's good. Okay, back to neutral. We're going to work on rotation next. We're going to bring the arm through. This is going to stretch the middle back, the joints where the ribs attach to the middle back and the spine. We're going to come the other way. Don't force this. Otherwise you will strain some muscles, you'll strain the joints. This is going to stretch the front of your chest and the front of the arm. Back in the other way. This is stretching the back of the shoulder blade, the back of the arm. We're going to be stretching some nerves as well that leave the neck and go down the arm to the fingertips. If you want to stretch your nerve that goes through your arm to the fingers, you can bring the wrist into extension. And again the other way. We're going to repeat both sides. I'm just going to do it the once on this side for the purpose of the video. I want you guys to do it a couple of times. Come into extension. Okay, back into the quadruped position. We're going to stretch the lats, so we're just going to sink back onto our heels, reach forward, sink back, and again just try and straighten the middle back, extend the middle back, don't force anything, and just stay there for a second, get back on your feet, on your toes. And just have a few breaths in this position and relax. Now we're going to work on lateral flexion, so I'm going to start to walk my way around to the left. And we're just going to relax and breathe into this position. Again, trying to straighten the middle back. I'm going to take it a bit further. And just relax and try and stretch that lat, this one on the right hand side, and come to the middle. Just reset your posture if you need to, and we're going to walk our way to the right now. I'm just going to stretch the lat on the left hand side. Just imagine you're straightening the middle back. Walk a bit further if you can. Just relax into that. Go a bit further. That's great. Now just relax and breathe into that. So a few light, relaxing breaths. And back to the Next, we're going to work on mobilising the lower back, and we're going to start with flexion. It's going to stretch not only the back muscles, it's going to stretch your hamstrings, the backs of the calves, fascia that runs down the backs of your legs, this posterior fascial chain. It's going to stretch the spinal cord, your nerves, the sciatic nerves. So it's a great nerve stretch at the same time. So we're going to use gravity for this. Just go into a bit of a dead hang position, like so. If you're here to begin with, not a problem. We're not trying to force it, we're not forcing the stretch, we're allowing gravity to just do it. So just get into your dead hang position, and then bit by bit you'll start to go lower. Just concentrate on breathing, relaxing, and you'll feel the tissues in your back, the backs of your legs start to lengthen. Again, this is stretching the spinal cord, the backs of the hamstrings, my nerves in the backs of the legs, the sciatic nerve. It's stretching all the fascia through my middle back, through my lower back, the fascia that runs down the backs of my legs. So all of that posterior chain, you can see now I'm touching the floor. I'm having to curl my fingers now, because otherwise I'm going to stop myself from going any further. You'll also maybe notice that I've not got a fully straight leg. I'm not locking my knees out. That'd be really uncomfortable. Slightly soft knee. Pretty straight but not fully locked out. That's absolutely fine for the purposes. And now my fingers are really starting to touch the floor. We want to do this for about a minute. But if you think you can go longer, carry on as long as you want. You can get a bit dizzy and lightheaded doing this, so if you feel a bit like there's too much blood rushing to your head, that's probably time to call it a day. Okay, perfect. Just slowly come back up. Don't move too fast, as you could strain your lower back as you come back up. And obviously be careful not to get too lightheaded or dizzy. We're going to do exactly the opposite now. We're going to work on lumbar extension. So it's back onto the floor, on your elbows, and we're just going to be in this position. So just stay there for a little bit, and then we can start to walk our way back up into further extension. Just set the shoulder blades back a little bit, just to straighten the middle back. Walk back a bit further. And if you've got more range of motion, you can come up onto your hands. And then depending on your overall flexibility, you take this to whatever's comfortable. Okay. Now, the next thing we're going to look at is the neck. So we're going to take the neck through its plain range of motions. We're going to start with flexion. So we're just going to drop the chin towards the chest. Hold that for a little bit. And then we're going to put a bit of overpressure. Just gently taking the head into a bit more flexion. If this is comfortable, okay. If not, just take it to wherever's comfortable. Just stretching the back of the neck, the spinal cord, your nerve roots, your middle back. Okay, slowly come back up. We're going to go into extension, the opposite movement. You don't need to take your neck into hyperextension. And we're not going to stay there for long because a lot of people can get dizzy, lightheaded. If it feels like it's pinching the neck, just take it to wherever's comfortable. But you don't need to strain at all. Next thing is lateral flexion. So we're going to take the head to the side. And we don't want to hitch the shoulder, shrug the shoulder, so I'm going to drop this down and just sort of grip hold of the side of the ball gently. Stop my shoulder elevating. I'm going to stretch the side of the neck. It's also stretching the nerve roots, it's stretching the nerve that goes down my right arm. So I can feel a bit of tension, of stretch going through my arm, that's normal. You can do the opposite way. Neck stretches I typically recommend holding for 10 to 15 seconds. The neck's a much more delicate structure, so we don't want to force it. We're going to stretch a different muscle now. That one was the upper trapezius largely. Next one we're going to stretch is on the top of the shoulder blade that goes to the top of the neck. It's called levator scapulae. So I'm just going to bring my arm around the back. And I'm going to try and bring my head in sort of that direction towards my left knee and foot. And now I feel it stretching on the top of my shoulder blade. That's perfect. This muscle can cause a lot of tension and tension headaches because its attachment site is the top of the neck. And the other side, again, not hitching the shoulder, keeping the shoulders down. So I'm going towards my right knee and foot. Next we're going to work on rotation. So I'm just going to actively turn my head until it's comfortable near end position. And now I'm going to relax my muscles. I'm going to use my hand to passively just put some over pressure. And count to 5. Back it off. And go again. So the key to this is to relax. Just use the hand to guide a bit of over pressure. The other side, take your neck actively to its end position that's comfortable. Relax and use your hand to get some over pressure. And relax. Go again. Now if your range of motion is this, absolutely fine. You go to whatever's comfortable for yourself. Do not force it. You do what's comfortable for you. There's one last muscle that's often overlooked, is actually the sort of front and side of the neck muscles. And we're going to just turn our head one way, 45 degrees. I'm stretching this side, so I'm going to keep that shoulder down and not elevated. I'm just going to tilt back until I feel a pull through here. You might have to play around with it, but you'll know when you've got it. And again, the other side. It'll stretch all the way through there. We're going to finish with a chest opener and just reset the posture. So we're going to straighten the middle back, lift the chest slightly. I'm going to start to rotate my arms outwards into external rotation. As I do this, I'm engaging my middle back, my shoulder blade muscles. I'm squeezing my middle back. Try not to elevate. Don't jut the jaw forwards. Keep everything nice and neutral. And just pinch and hold for a count of 5 to 10 seconds. I'll do that from the side. So I'm not starting like this. I've got a nice neutral posture. Shoulders rotate, arms rotated outwards. Keep the jaw, chin neutral. Lift the chest, straighten the middle back. Pinch the shoulder blades together. Hold for a count of 5 to 10. I'll do it this way for you as well. So I'm just going to lift the chest, straighten the middle back, rotate the arms out, and squeeze the shoulder blades together, keep that chin, keep that neck neutral. Okay, and there you have it. There's a simple routine to mobilise your entire spine. If you have any problems with this, if you have any questions or concerns, please get in touch.